Good afternoon, everyone, and welcome to September's CTIS Bitesize talk. My name is Vasiliki Papoianou, and I'm a Change Management Officer working for the European Medicines Agency. This is the seventh session of a series of short talks that cover a specific functionality in the Clinical Trials Information System, or CTIS. Today, CTIS experts will present the functionality of notifications that are related to trial and recruitment period. Throughout the session, there will be parts with live system demos and with questions and answers. To collect your questions, we're using Slido. As announced on the event page, we have invited you to submit your questions in advance, and we would also like event participants to submit their questions during the session through Slido. In your screens, you can see how to use Slido. If you go to www.slide.do and use event code BT28SEP, BT28SEP, or you can scan the code with your phone or tablets. The QR code will take you directly to the Slido event. Alternatively, there is a direct Slido link in the event page on email website. Whichever way you choose, once you are inside the Slido event, you can type in your questions and upvote other users' questions that you want to see answered. We aim to answer the questions received in advance first and move on to the most popular questions submitted live. So please ensure to scan through the submitted questions and use the thumbs up feature. Also remember to keep the questions focused on the CTIS functionality notifications so that we can best answer them. Now, in case this video screen is not easy for you to see, please read the instructions in the gray box underneath the embedded video on the event page. There, you can always find a link towards the live broadcast in full screen. The same link is also posted in Slido for you to see and use as soon as you join in Slido. So once you have the video on full screen mode, you can further opt to increase the video quality by clicking the HD button in the bottom right of the screen. We recommend an analysis of 720p, but you can even go higher. Also, having a stable internet connection helps optimal viewing. I hope this technical information has been useful to all of you. Now, I would like to introduce our speakers, Laura Piopo and Ana Rodriguez Beato Sanchez. Laura is a scientific officer in the CTIS program working on CTIS development, including leading on data protection and training the CTIS community on system functionalities. Anna joined EMA in 2003, where she has held several positions from scientific administrator to head of clinical and non-clinical compliance service. And today she is CTIS delivery workstream lead. I will now hand over to Laura, who will take us through a short presentation on trial and recruitment period notifications. Then sessions with live demo and QAs will follow. Please remember to submit your questions in Slido and upvote questions that you want to see answered first. So Laura, over to you.
Thank you very much, Vasiliki, for the kind introduction, and good afternoon, everyone. I will now share my screen and we can start with the presentation on CTIS functionality for notification. I hope you can correctly see. Okay. Yes, thank you for confirming. So as we were saying earlier, the topic that will be presented today is about notifications that can be submitted in CTIS. There are mainly two types of notifications, the ones that fall under the trial recruitment and periods notification, including start of trial, start of recruitment, end of trial, temporary hold. And then there are the so-called circumstantial event notifications. So basically events that can happen or not during the life cycle of a clinical trial, including the occurrence of unexpected events, serious breaches, urgent safety measures, and submission of third countries inspection reports. So now these circumstantial notifications will be covered in the next Bitesize talk. The focus of the presentation today and the demo session is purely on trial periods and recruitment periods notification. So let me start with a description of the notifications that are mentioned in the article 36 and 37 of the clinical trial regulation. The first one is the start of trial, that is defined in the regulation as the first act of recruitment of a potential subject for a specific clinical trial. Also, the European Commission Q&A is quite clear in defining what could be really the start of trial. This can be the date of the initiation of the clinical trial at the site, or the date when the first trial specific advertisement is published. Following the start of trial, the next notification, because notifications we will see in the system are submitted in a logical order, in a sequential order. The next one is the start of the recruitment, which is basically following the requirements of the regulation to notify the date of the first patient first visit. So this first patient first visit is basically equal to the start of recruitment button that is available in CTIS. Now the regulation is clear that the recruitment at the site should happen within 2 years from the trial authorization. And if no patients are recruited within 2 years, it is possible for the sponsors to request an extension of the recruitment period beyond 2 years. And this can be done with a substantial modification that will need to be authorized in order to allow the extension of these timelines. The next one is the end of recruitment, that is equal to the act of not recruiting any more new subjects in the member states. And the last notification that we have presented in the slide is the end of trial, that is equal to last patient last visit or another point in time as defined in the protocol. This also applies to early termination because, of course, it is possible to submit in the system notification of an earlier termination that can be related to a change in the benefit risk profile or not. In this next slide, we can see the other type of notifications that can be submitted, including temporary hold, restart of trial, and restart of recruitment. The temporary hold, as defined in the regulation, but also in the Commission Q&A, is an interruption not foreseen in the protocol on the conduct of the trial, with intention of the sponsor to resume the restart the trial. Also in this case, as we have seen for the early termination, we can have two types of temporary hold, benefit risk related or not. And if the trial is not restarted since the hold was initiated within 2 years, then also in this case the trial will end, and basically the end of the period will correspond to the end of the trial. An extension to restart the trial beyond the 2 years is also possible, in this case with authorization of a substantial modification. Then the restart of trial and restart of recruitment. The restart of trial is really important if the temporary hold was due to a change in the benefit risk profile. According to the regulation, the restart can only occur if a substantial modification has been authorized by the member states concerned. And the restart of recruitment can be necessary also following the restart of the trial. So as I was saying before, the legal basis for the notifications, the obligation for the sponsor to submit notifications and the timelines of 15 days are all specified in the articles 36 and 37 of the regulation. I would like to draw your attention to the fact that we have a training material to cover this topic, that is module 5 of the EMA catalog on CTIS, available on our website. And there are also relevant clarifications on the interpretation of the legal texts and feedback from the European Commission in the dedicated Q&A that is published on EudraLex Volume 10, and particularly this topic is in section 10 of the document. You might already know that there is a new version that has been published very recently in September, and is the version 6.2. So this is a screenshot that we have taken from the system, where you can see how it looks like and how the trial and recruitment periods notifications are displayed in CTIS. We will now actually access the system, and I can show you the entry points and how you can reach this section in CTIS, and how the notification submission can take place. But just before we move to the demo part, and we can do a deep diving in the system functionalities with the system open in one of our test environments, I wanted to tell you or remind you some main principles and concepts around the submission of notification. First of all is that the notification to a member state can be submitted as soon as the trial is authorized by that member state. So if the sponsor is running a multinational, multi-country trial, the sponsor does not need to wait to have the trial authorization in each and every member state concerned before they can start submitting notification of start of trial and start of recruitment in the applicable member states concerned. The pre-requirements is that that member state has authorized the trial. The first notifications that can be submitted are, of course, start of trial. This is the first one, or also the sponsor can submit directly an end of trial. That in that case would be equal to an early termination because the trial has not even started. The submission of this notification is sequential and follows a predefined logic that now we will be able to see in the system. The notification can be submitted to one or more member states concerned simultaneously with a multi-select functionality. Let's say that you have the same start of trial date in one or more country. With one notification only, you select the member states where the notification is applicable, and with one form, you populate only one form, and the notification goes to all the member states concerned. The CTR is very clear in defining the timelines for the notification submission, that is 15 days. However, CTIS is flexible enough to allow you to submit basically a start of trial, start notification that will go, let's say, beyond the 15 days. So, of course, this is done in order not to block any users, but the member states can monitor the compliance followed by the sponsor. So, from when the start of trial really occurred to when the submission in the system is done. By a system point of view, this can be done even 6 months later. But, of course, there are clear requirements in the regulation to specify the time period. And then you will see that there are documents that can be attached to the notifications. There is a placeholder for having documents uploaded, but this is an optional field. So this means that there is no expectation that for each and every notification a document is attached. Now let's go to the demo. And what we will cover in the demo is the entry point, so to show you how to access the notification section, how to populate and submit a notification. We will start with start of trial, start of recruitment, and we will see how they are displayed in the system. The document upload functionality, the withdrawal, and also the publication aspect, because this is one of the questions that we get many times on when notifications are published. So I'll stop sharing for a second, Vicky, in order to have the, and maybe I will also put my camera off for a second because the connection can be better. and then I will show the system functionalities. Okay, I hope it's up again, should be working. So this is one of our test environment. We have this clinical trial. From the summary page, I can see the general information on the trial. I can see the product use, I can see the member states, and I can already see that is a multinational clinical trial done in France and Greece. In Greece, the trial is already on hold, and I can see it's halted, the status, while in France is simply authorized. I can see the submission date, the decision date, and the general information on the study. From the full trial information, you have access to the latest authorized version of the dossier, and you will see that next is the notification bar, the notification sub-tab, let's say. If I select France, because in France the trial has just been authorized, as I was saying before, you see that the only two buttons that are enabled, what I can choose is the start of trial and the end of trial. I cannot select any other notification because it would not make sense that I'm able to submit a start of recruitment or an end of recruitment if I have not previously populated in the system the details of the start of trial. So I will click on start of trial for the country that is France, and it's very simple, the functionality. Basically, I only have to select a date from the calendar that is offered. I also have the possibility to upload a document, and without going through the upload functionality, because you might have seen this already for other parts of the system, this is a common feature that we have in many sections and places in CTIS, where you can upload a document to provide more details to the member states if this is needed. Maybe let me quickly just show you, taking one document. To verify that you can have for this functionality as well the possibility to have a document for publication and a document not for publication. This is also displayed in this section, and is possible for the users to use. So submitting the trial, I could not attach the PDF that I've selected, but I will go through simply with the notification start date. I see that selecting 27th of September, the system automatically populates the date that I've included in the notification form in the table. And if I select now France, I can see that more buttons are basically enabled now, including the start of recruitment and the temporary hold, and always the end of trial. The start of trial is no longer accessible. I cannot use this anymore because I've just submitted the notification. So I can now select start of recruitment and select another date and progress with the submission. And I can see that now the information on the recruitment appears in the table. If I select the member states, this is quite interesting. I can see the history. So there were notifications that were previously submitted and have been withdrawn. And these are the last two. You see, this is the submitted date, is today. I've submitted the start of trial and the start of recruitment. So if you as a user would like to have access to the history of notifications that are submitted for a specific member state, is quite easy to access the information by clicking on the member states hyperlink, and then you can see the business key that is generated, the date when the information has been submitted, and then you can also access the form. So I can see that the start of trial date was 27th of September, and I can see that this is a version 1, and I can see the start of recruitment, and I can see the information, and this is also version 1. I can also update any notification with the pencil functionality. That is also a common functionality available in CTIS for dossier fields, for the structured data in the dossier, and so on. Now, let me clarify in terms of publication that start of trial, start of recruitment, end of recruitment, restart of recruitment, and restart of trial, basically all of them, with exception of part of the temporary hold, are published as soon as they are submitted through the portal to the database. So this means that when the sponsor populates the information in CTIS secure domain, automatically the information is available in the public website. Regarding the temporary hold, and this is in line with our transparency addendum, the appendix on disclosure rules, the whole temporary hold form is published with exception of the section for the reason and the explanation for the temporary hold. That part is only published after member states assessment. So there is a specific section of the temporary hold, and I will show it better once that we present temporary hold, that is published only after evaluation by the member states. But in principle, all the rest that you see here on the screen are available in the public domain, the information, as soon as the notification is submitted. Clicking on the notices and alerts that as a sponsor, I'm sure you are aware of as CTIS users, this is the main point for accessing information. I can see that notification of start of recruitment and start of trial were submitted for this trial, because this is what I've just done with the identifier. So this is displayed and available to the sponsors as well as the member states concerned that receive notices in the notices and alerts tab to be aware that basically the trial has started. So I'll stop maybe here. I stop sharing. And before we move to temporary hold and restart of trial, maybe Vicky and Anna, we can take some of the questions that we have.
Yes, I am preparing to share right now. And I will read out the questions. And we start from the questions that have already been submitted prior to the event as we announced on our website, and we will go from the most popular ones to first, and this will be our first Q&A session. So, starting, a question for Laura. Is any documentation needed to verify the date of study start, recruitment start, end of recruitment, etc., or is the submission of the date all that is required in CTIS?
Thank you, Vicky. Yes, this is indeed a good question and linked with what we were just showing. So there is no a template or a mandatory documentation that needs to be attached to this notification. Basically, the date is all that is needed. However, the functionality to upload a document, if this might be required for any reason or by the authorities or because the sponsor needs to give any details, additional information on the notification, this can be done with a simple document upload, and this is the reason why we have the placeholder. We might have another similar question going through the list about the fact if there is a template, or a document to refer to, and this is not the case. So really the key information, the mandatory field is the date.
Yes, I think you were referring to this question, so
exactly. Maybe we can read it for a second so also
yes,
everyone is clear on the content.
Is there any guidance on when a related document would be needed for notifications, such as the start and end of a trial in a member state? Is there any expected content format or template for the notification-related document in CTIS?
Perfect. I think, Vicky, indeed, we can close both of them. Thank you.
Thank you. So next question is for Anna. When a notification is updated and no deferral is in place, will the update appear on the public portal immediately?
I apologize. I think Laura in some way has also addressed this question when presenting the demo. So just to make clear that the deferral for notifications, it applies specifically to the serious breach, urgent safety measure and unexpected events, because for these particular notifications, it's required first to be assessed by the member state concerned that to confirm that they are, let's say, valid, for example, in the case of serious breaches, and only up to the point that there is a conclusion of that assessment and the first member states that is involved upload that information on the assessment, then they can trigger the publication of this deferral. So therefore, for the other ones, start of recruitment, start date of the trial. So the other one, those are published immediately from the moment you submit those notifications. So the only exceptions, as I said, will be the serious breach, unexpected event, and urgent safety measure, where the sponsor can decide it to be published as a designated time, which is when the first member state has, let's say, posted their assessment on those notifications and then trigger the publication. Or there is another option at the time of the finally the publication of the summary of the results. So this is the options that apply in terms of deferral, but for these three particular notifications. For the others, they will be made publicly available from the moment you submit them.
Thank you, Anna.
And just to comment that more information, there is a document on the transparency rules that are applicable in the EU portal and the database. This is available from our website, and you can find there all this information, not only for notification, but for all the deferrals that has been built in the system.
Great, thank you for this answer, Anna. Let's move on to the next question that is for Laura. When each notification is submitted or updated, CTIS records the name of the CTIS user, visible when clicking on the member state. Are these names visible only to the sponsor, or would names also be visible to member states?
Thank you, Vicky. And yes, indeed. I mean, this is a functionality, something that is displayed. We noticed only for the notifications that indeed the name and the surname of the user submitting the information is displayed. This is accessible also to the authorities, so it's not only visible to the sponsors. We are going to update one of our documents on the data protection to make this clear, particularly data protection notice that is available in our public website, where we list all the information that is related to personal data, visible or accessible via CTIS, and published. Now, for the notifications, I would like to clarify that there is no visibility in the public portal, in the public domain, of the name and surname of the sponsor users that have submitted the notifications. This is visible only in the secure domain for the sponsors and the authorities. This is something that we have only for the notifications, basically, and we have to make sure that all the documentation on data protection reflects this accordingly. So it's one of the things that we plan to update and communicate. Thanks.
Thanks, Laura. Thank you very much. Moving on with a question for Anna. While CTIS supports notification of and records the global end of the trial date, is there any obligation / CTIS support for the notification of the global start of trial date, such as when a trial has begun outside the European Economic Area?
I think you have to provide in CTIS the information that is requested in the system, and there is no requirement in CTIS to enter the global start of trial date. So therefore, this information is not needed in the system. There is no field to record this information.
Thank you. Moving on with a question for Laura.
I think, Vicky, I can quickly see that the other questions are on temporary hold, end of trial. So maybe we can pause here. I continue with the demo and the presentation, and then we take the questions, because I think we have addressed the ones for start of trial, documents updated, global start of trial. As Anna was saying, there is no requirements in the regulation, so we don't have this field in CTIS. And then, yeah, we continue with the other question on the other topics that I will present. Thank you for making me host. So I should be able now to display. Again, maybe let me stop sharing, because when I present to have a better quality, I put the camera. Okay, and I share again. Okay, so now moving on, temporary hold and restart of trial. So the requirements or the definition of a temporary hold and subsequent restart of trial that can occur. The definition of temporary hold is in Article 228 of the Clinical Trials Regulation, that says that a temporary hold of a trial is an interruption that is not foreseen in the protocol of the conduct of the trial by the sponsor, but there is an intention from the sponsors to resume the trial. So one of the questions that we get many often is if the temporary hold is for recruitment and treatment all the time, or can be recruitment only. And I think the Commission question and answer is quite clear, is in section 10, explaining that basically the stop of the trial activity, as described in the protocol, can be applicable for the recruitment part only, or also for the recruitment of new patients and treatment of the existing patients at the site. So both scenarios would fall under the definition of temporary hold. Why it can be a temporary hold? Because of an unexpected circumstance that can lead to a change in the benefit risk profile or not. Now, in case of a change of the benefit risk profile, the restart of the trial can be done only if a substantial modification of any type, so part 1 only, or part 2 only, or part 1 and part 2, has been authorized by the concerned member states. And as I was saying before, the substantial modification to restart the trial should be submitted within 2 years since the hold. Otherwise, the clinical trial will be considered ended. Now, in case of temporary holds that are not due to a change in the benefit risk profile or benefit risk balance, such as, for example, shortages or lack of a supply of the IMP, then the sponsor can just simply notify the restart when the problem is solved, and this has been done from within 15 days, as we have for most of the notifications. So if the temporary hold is not resumed within 2 years, the expiry date of the period will be considered the end of the clinical trial. And I've highlighted, make it in bold, the end of the clinical trial, because this then triggers the calculation of the 12 months for the submission of summary of results. So the end of a clinical trial in the EA, and we will see this later on, of course, is the starting point for counting 12 months for the submission of summary of results, or 6 months for submission of results for trials done in pediatric population. If the sponsor wish to, following the 2-year period of the temporary hold, to request a restart date after the 2-year period, they can do so by requesting a substantial modification. But this substantial modification, if the sponsor wants to extend basically the temporary hold period after the 2 years and wish to restart after these 2 years, they have to submit the SAM during the 2 years period of time. They cannot do it afterwards. So there are some complex business rules that have been implemented in the system to make sure that there is a validation of the date when the request for the extension is done, and that the 2 years period are covered. Now, this is a screenshot, again, taken from the system, but we can then spend a bit of time navigating in CTIS and see how it looks like. But basically, these are the fields that a sponsor will have to complete once they populate a form for temporary hold. The date of the hold, when it's planned to restart the trial, but this is just an indicative value that is included here. There are no business rules associated with this planned restart date. And then a clarification if the trial has been put on hold because of reason related to changes in the benefit risk profile, yes or no. The reason for the temporary hold and the explanation. And please consider that these are exactly the fields, especially the explanation free text box, that will be published, only this field following the assessment done by the member states concerned with an ad hoc assessment. And then the follow-up measures, and then if the treatment has been stopped, and the number of subjects that are still receiving the treatment, if this is applicable. And then again, you can attach a document. Notifications, publication, a temporary hold not benefit risk related is published immediately. Temporary hold benefit risk related is also published immediately with exception of the explanation free text. After the assessment done by the member states, then the field goes in the public domain. Restart of trial for a temporary hold not benefit risk related can be submitted as soon as the issue is solved, as I was saying before. And for the other temporary hold, the one with a change in the benefit risk, the restart is dependent on the authorization of a substantial modification. So I hope the concepts are clear because this really makes a difference in the use of the system. Particularly important that when a sponsor populates a substantial modification form of any type, part 1, and part 2, and so on, they have to tick the right value, that is the one that you can see displayed on the screen, restart of trial, to make sure that a substantial modification, benefit risk related, a substantial modification that is submitted for a temporary hold, benefit risk related, I should say, is clear in the scope that is to go ahead with a restart of the trial. And there are some business rules implemented in the system when only substantial modification that have been authorized when this value restart of trial has been selected will be displayed to the users for enabling the restart of the trial. So it's really important to tick this value from the SM form. Of course, this element is also described in detail in our training material, and it should be clear to the users that the selection of the restart of trial date is what makes the difference here. So again, I'll stop sharing to open the system again, and we can have a look at the temporary hold form. Let me refresh the trial so we're sure that we get the latest, and I share again. Okay, so we are in CTIS for the same trial that we have used before. We have done start of trial and start of recruitment before. For Greece, this trial was already halted. So we can see that the start of trial date was the 9th of September. And then, okay, on the same date, the trial was put on hold. But let's say that I want to see more about the information for the temporary hold. So as I was showing you before, it's enough that I click on the country hyperlink. I can see the details of the start of trial. I can see the temporary hold. And I can have a look at the form, and I can click on update. I can show you in this way the update functionality. You see all the fields can be changed. The plan restart date, let's say that we will need a couple of weeks more. Change in the benefit risk profile. For the time being, we have selected no, but if I would select yes, then you see there is an extra field here to say the reason of the change of subject safety and or the impact on the benefit risk balance. This is a free text that I can modify. And then there are a list of values for the reason for the temporary hold. sponsor decision, which is always the case, reprioritization of the trial, safety-related issues, or issues with the sites, medicinal product, and so on. And then the explanation free text, follow-up measures, and the possibility to update also the number of subjects still receiving the treatment. Now, if I apply a modification, an update on the notification form which was already sent, I will have to populate this mandatory field on the justification for the change. So here it can be explained which fields have been updated and the need for an updated text. So here I can just include test and I will click on update. And I will see that now basically I can show you the symbol because this is something displayed from this section. I can see that the symbol has appeared now to explain that the temporary halt is related to a change in the benefit risk. Now, I can maybe show you then the restart and how it would look like, considering that we do not have a substantial modification enabling us to restart the trial. So just to give you a flavor on how it looks like, I want to restart my trial. Halt, now it appears also here, is for a change affecting the benefit risk of the trial. I select a date, today, and okay, it seems that it went through, although, yeah, we had the temporary halt. So let me withdraw this because an error message was appearing before. So it seems that this was not taken. So we will need to look at the submission of the restart, because just to make it very clear, this is dependent on the use of having a substantial modification that has been authorized. If I would click on no and I update and include here a justification text, then the restart of the trial should happen without having any problems. So let me refresh the page. Yeah, and now I've taken this because the symbol is gone. So the temporary halt, because I have updated the form, is no longer related to a change in the benefit risk profile, and I should be able to restart the trial without having the request for SM. So we can see the restart date. We will need to look a little bit at the previous system behavior, because I think the system did not take the change from not benefit risk related to benefit risk related. I really would like to emphasize that the restart of trial when there is a temporary halt related to a change in the benefit risk profile is dependent on the substantial modification. So this is also to give you a flavor on how it looks like when you select one button only. For France, I can do end of trial, temporary halt, and end of recruitment. For Greece, I can do the same, and start of recruitment, because has not yet been populated, so is all sequential and depending on the flow, on the steps of what has been already submitted. And in the interest of time, because we still have the end of trial, maybe Vicky, I'll stop here and we can take a couple of questions for temporary halt. I stop sharing. Thank you.
Many thanks, Laura. I will share now the questions that we have received in advance, and some of them contain questions on the halt of trial. I have added some new questions on this subject, so let's ignore the first one for now, the first ones, and maybe we can take this one. This is for Anna. When a temporary halt or other notification results in an ad hoc RFI, does the notification need to be referred to in the sponsor's ad hoc RFI response?
I'm going to connect my video, sorry. Yeah, so I think in principle there is no a need for that, and the reason why is because the RFI is linked to an ad hoc assessment in the system, and in the system, in the ad hoc assessment, also the member state is requested to provide the link to, if this ad hoc assessment is linked to a particular notification, and there are several options. So, and therefore, already the member states has linked the ad hoc assessment to the notification, and the RFI is also linked to the ad hoc assessment. So in principle, there is no need for that. However, this does not prevent for you, if you upload a document, to indicate already there that this RFI is part of this notification. So you can do it if you wish to do so, but bear in mind that in the system, ad hoc assessment are linked when applicable to notifications. So this member state has to establish that link, and the RFI is also linked to the ad hoc assessment. So all these links appear under the ad hoc assessment that is available to member states.
Thank you, Anna. Let me find the question that was submitted in advance first. This is for Laura. Can a temporary hold notification be limited to recruitment only, or does it always apply to both recruitment and patient visits?
Thanks, Vicky. Yes, as we were saying during the presentation, it can be for recruitment only also, if this is applicable. So both options are okay. Can be a hold due to recruitment issues at the site, or recruitment and treatment of patients or patients' visits. This is also clarified in the Commission Q&A.
Thanks, Laura. Now we can move on to some fresh questions on temporary hold. When a study is temporarily halted, is it still possible to create safety notifications in CTIS or perform ASR submissions? Who would like to take this question between you two?
A safety notification, if this is, for example, an urgent safety measure, unexpected events, or serious reporting other notification, I think it's possible. There shouldn't be any rules preventing the submission of other safety notifications like an urgent safety measure, because the trial is on hold. And I would say is also the case for ASR submission, if Anna confirms the understanding.
I think it's also the same for ASR submission, because here the trial has not ended, so the sponsor has still the obligation to do this submission. So I don't see why should not be the case.
Okay, all right, thank you. And now we can move on to this one. If a study is halted on safety grounds, currently some countries require this is firstly notified at as USM, followed by separate study hold submission. Is this also the case under CTR, or is it enough to notify study hold only if the only measure is study hold?
Yeah, okay, this is a good question. So basically it's the interplay between urgent safety measure and temporary hold. So in some previous events on notifications or clarification also with the European Commission, there was a question raised on what should I do if I'm putting a trial on hold in one particular site and not in the whole country. So the trial is not on hold in the whole member state, but it's just a problem with one site or two sites and so on. So in that case, the urgent safety measure would be needed to notify the status in that particular site. But if the condition goes beyond this requirements and the trial is on hold in the member states, then only the notification of temporary hold in that member states would be sufficient. So it's always better, I would advise always to consult the national competent authorities in terms of expectation on when they expect an urgent safety measure rather or versus a temporary hold. I just wanted to clarify that in the past, it was mentioned that if the issue is specific for one site only, then the urgent safety measure can be a suitable solution. So this would be basically the approach. But you know, there is the list of NCAs and contact points in the EU member states published on EudraLex, volume 10. So in terms of expectation, it's also good to check with them. In terms of system functionalities, there is no issue. Let's say there can be multiple notifications sent.
Okay, thank you, Laura. Do we see? Yes, we have answered that. Yes, here's another one. So when you want to prolong the 2-year period for a halted trial, is the SM subtaxal modification to be submitted before the end of the 2 years, or the SM to prolong the period has also to be approved?
Is enough if it's submitted during the 2 years. It doesn't have to be approved also during the time period. And this is also clarified in the Commission Q&A that says that if a sponsor wants to prolong the temporary hold, regardless if it's safety related or having an impact on benefit risk, regardless if it's yes or no, they have to submit the SAM before the end of the 2 years transition period. This is what is specified in the text.
Okay, thank you, Laura. Perhaps can we take this one now, or we can leave it for later?
No, thank you, Vicky. I think it's a good one to take now. Is there any guidance or best practice for updating notification? Anna, would you like to take this? I cannot.
Yes, but, well, as far as I know, there is no a best practice for updated that has been published for updated the notification in CTIS. No, not as far as I know.
Yeah, I confirm that. I'm also not aware of any specific document on best practice for updating. Remember that we have a sequential order. So in terms of start of trial, start of recruitment, end of recruitment. If you want to modify the date of end of recruitment, the end of recruitment, we have some logic basically implemented in the system that you can update only the latest notification that is submitted. And this is because there needs to be a consistency in the dates. So start of trial first or equal to start of recruitment and then end of recruitment. We cannot have in the system an end of recruitment that is before the start of trial, for example. So in order to keep this integrity in the logic, you can always update if you have start of trial, start of recruitment, end of recruitment. You can only update the end of recruitment. And then basically if the end of recruitment is withdrawn, is no longer applicable, then you can update the start of the recruitment. That was the previous one. So it might seem a system issue initially, but is really based on the logic that we need to keep a consistent sequence of events and the dates for the submission of the notification. If one notification is no longer applicable, it can always be withdrawn, and then it is like it was never sent, basically. So just to clarify a bit on the update part, because I've shown with the system functionalities is the pencil, but also to say that for notifications we have all this business logic behind on how it works.
Okay, thank you, Laura. Perhaps we can take also this more generic question before we move on to the next part that has been submitted in advance, and it reads to: if a notification needs to be removed, not just updated, does CTIS support deletion of the notification, or would a request have to be made to the EMA service desk for removal?
Perhaps I can take this one, Laura, and you can complement. But as I think, as Laura has shown, you have the possibility to update, but you have the possibility to withdraw the notification. So if you think that you made a mistake and you submit the notification for one trial to another one, you have the possibility to withdraw the notification in CTIS.
Indeed, so there is no need for you to contact the service desk to request a removal, because for going in order and complementing also what Anna was saying, when you submit these notifications, start of trial, start of recruitment, end of recruitment, and so on, they are immediately available in the public domain. If you click on withdraw, these notifications are also automatically removed from the public domain. The situation is different, as Anna was explaining, for unexpected event, serious breaches, safety-related notification, or more substantial issues, let's say, that are only published after they are assessed. So for this other circumstantial notification, you need to contact the service desk to have them removed from public web, because they've been assessed and published. So to have them removed, you need to contact the service desk. But for the period and recruitment related notification, the information can easily be removed from the database and from the public website with the withdrawal functionality. And you do not need to contact the service desk for this purpose.
I think there is another session after this one to cover this other type of notifications where it will be shown how it works.
Indeed.
But for the ones we were discussing today, you have the withdrawal button in the system.
Exactly.
Thank you both. I'm just scanning quickly to find any more relevant questions, and I spotted this one. If you want to take it now, if the trial is halted in just one site, but the reason is not related to safety, the notification to be done is still an urgent safety measure?
Yeah, that's a good one. I think for this one, we would need to, I would check with the member states in terms of their expectation, because yes, urgent safety measure, indeed, it would, as defined in the regulation, an expected event that can have an impact on the safety profile, and if the halt is just in one side but is not safety related, then USM would not seem to be the right way to inform about the halt at that site. For this, I would contact the member states concerned to clarify with them expectation in terms of notification. I don't know, Anna, if you have more details on this.
No.
If the trial is on halt in one site only, not for safety reasons.
No, and I don't think in the Q&A from the Commission this is also clarified. So yeah.
Okay, thank you for the answers. So we can move on to the next part.
Yeah, let's move on then to end of trial and summary of results. This is the last part. And then, Vicky, we can take the outstanding questions that were already sent on end of trial. And if there are new ones, there are quite few new ones, right? We could see.
Yes, there are some new.
There are some new. Okay, so let me put then the system back again and reload the page. And share. Okay. So this is the same trial. We had the halt before. We changed the value from benefit risk related to not benefit risk related. We could do the restart. And now if I select Greece, I just want to send an end of trial notification, and I would select the day of today, and I click on submit. And I can see that basically the end or early termination, because it's the same form for both, apologies, it's exactly the same date that you see displayed everywhere, but let's say that the trial has ended today. If I now select France, basically I can also click on the end of trial date, and you will see that basically this end of trial in the member states for France will be equal to the end of trial in the EA. So the system also displays the form for the anticipated date for the submission of the summary of results. So in this way, as a sponsor, I can say, okay, the trial is ending on the 28th, and I plan to submit the summary of results. Let me take even 24 February. So beyond the 12 months that are expected from based on the regulation, the sponsor, if the trial is done in pediatric population, has 6 months for the submission of summary of results, or otherwise 12 months. Here we are going beyond the 12 months, so I can explain that I will provide all the results, and I can explain the justification later than 6 months. This is apologies for this. You should say justification that the results are to be late. It's not only later than 6 months. This is a UI issue that we have. And let's say that the trial is still running outside of the EA, and here I can just put some text, and basically I can then submit my notification that will be equal to the end of trial, and you see how automatically the status here has changed, and the trial is ended everywhere. And I can see, although the value displayed here should be 2024, so this is also a small typo that we have, that the notification in 2 countries has been recognized by the system as the end of the trial in the EA that was submitted today, and I will provide all the results. The anticipated date for the summary of results, this is a bug because I've selected a date in the future, 2024, but it's 2023 that is displayed, so also something to look at. I can update the results date. And let me select again 2024, I think it was February, and keep the text and update. I can update the functionality, and now has taken it. Okay, so it seems that not always the initial values are retained, is also what we have seen with the temporary halt before, but now clicking once again on updating the results, the value is displayed. So might be a matter of reloading the page really and making sure that the latest, very latest input is recorded. So if there are sites outside of the EA, which is not the case in our trial, because I see I do not have any button here, it will be possible for the users to record in the system also the global end of trial. So in this case, no button is displayed because there are no sites outside of the EA, but if there are any, then this will be visible from, will be possible to populate in this section. The end of the trial, as I was saying, is important for the submission of the summary of results. And as you have seen from the drop-down list, the sponsor can clarify if they're planning to submit all results, partial results, if for example this is applicable, or no results if the trial has not yet has not started at all. I think this is a simple functionality. Let me see from the presentation basically if everything has been covered. This we have seen that the end of trial notification is submitted per member states concerned. The last end of trial notification is equal to the end of trial in the EUEA, and when completing the end of trial in the EUEA, the sponsor is prompted to specify the anticipated date for the submission of the summary of results. And this you have already seen from the system how it looks like. Every time that a notification is sent, notices and alerts are generated. And for this one, I would like to show you, you see ended is now in green before the status was authorized, because if the trial has ended in one member state only, in 2 member states, but not in all of the member states, then the trial status will remain as authorized. But as soon as the last end of trial notification is submitted, then we can see that the overall trial status changes and now is clearly marked as ended. And once again, if you want to see the history of what has been submitted, remember to click on the country details, and then you can see the full list of events. Vicky, in the interest of time, because I know we have 5 minutes for the final wrap up, maybe I will stop so we can take some more questions from the list related to end of trial or other topics, outstanding topics.
Okay, thank you, Laura. We will have time to answer more questions now. And let me find the one that was submitted in advance, and we start from that one. And here we go. Once the end of trial EA date notification is recorded, submitted in CTIS, can this be updated? For example, if the summary of results were delayed during this notification due to ongoing sites outside of European Economic Area, can this be corrected?
Yeah, let me unmute the mic. Yes, indeed. I think the question how it's phrased is not very clear, but I guess what was meant is if the summary of results are delayed because the trial is ongoing outside of the EA, can I inform basically the authorities that I will submit my summary of results beyond 12 months? And the answer is yes. I think you have seen it also from the system that is possible to update the anticipated date for the submission of the summary of results. So you don't have to update the end of trial notification, because the end of trial in the EA has occurred and is the date that you have captured in the form. What you need to do, if we understand the question correctly, is to update and inform the authorities on when you are planning to submit the summary of results. That can be 14, 15 months after the end of trial or 2 years after the end of trial. And this you can do via the update functionality for the anticipated date of submission of summary of results. So the answer is yes, you can do it in the system. And the notice is sent to the authorities, of course.
Thank you, Laura. We're moving on to the questions received today, and we start from the most popular ones. So here comes this one. For transition trials, is it possible to put in CTIS a start of trial or recruitment in the past?
Yes,
I can take this question.
Yes, Anna.
Yes, just to confirm that is possible, because obviously these are the key fields that are essential when you transition a trials, because we know that this trial were performed in the past under the umbrella of the directive. So when you transition the trial, you have to indicate that it's a transition trial, and therefore these dates it would be possible for you to select dates in the past.
Thank you. I think there's a question related to that about here it is, about the start trial date. So if the start trial date is entered wrongly, how can it be corrected? Directly in the system, or a ticket needs to be opened?
You can do it directly in the system. So if you have a start of trial date that is submitted, and this is the only notification that you have submitted, you can basically click on the member states hyperlink, as I was showing you before, click on the pencil and change the date. You definitely do not need to raise a ticket for this. If you have a start of trial and a start of recruitment, the start of recruitment is the first notification that you can update, or withdrawing this, you can also then amend the start of trial. So as I was explaining, is in sequential order because we need to have a sequence of events. So the date needs to match. You cannot have a start of recruitment or an end of recruitment that is before the start of trial. So the update functionality is in place. It's just that you need to keep in mind all the notifications that have been sent in the meantime, let's say. And is accessible clicking on the member states hyperlink and using the pencil button.
Okay, thank you for reminding us, Laura. So can we take this one? What happens?
Yeah, I can take this one.
Okay, what happens if the sponsor does not enter notifications within 15 days?
Well, I think I don't think in terms of the system there will be an issue if you have started your trial and you have not entered the notification. In principle, from the system perspective, you will not receive probably any warning, but you have a legal responsibility. So the regulation makes clear what are the deadlines for you, and if you don't comply with those deadlines, means that you are not in compliance with the clinical trial regulations. So if there is an inspection or an audit, this will be identified and there will be consequences. So that's what we can say from our side. But from the system perspective, obviously there is no problem, but as Laura has explained, there is a logic. So you cannot enter the start of recruitment if you forgot to enter the start of the trial. So in some way, if you know that you forgot to enter the start of the trial, and when you are going to enter the start of the recruitment, then you will have to enter first the start of the trial in order to be able to do the next one. So we have the logic. But if you forget until you enter the following date, as far as I know, the system does not have any warning or will remind you that you have to provide this information. It's more your responsibility as a sponsor. I don't know, Laura, if you want to complement or
No, correct, absolutely, Anna. And yeah, we mentioned it is in the slide. In fact, there are no business rules implemented. Would be too restrictive. You can submit beyond the 15 days period, but as Anna was saying, it's a matter of compliance with legal requirements. So nothing more to add.
Thank you. Moving on to this one, is it possible to download, export a summary of the notifications information from CTIS?
Yes, I think from the download functionality, it's possible also to export notification details. Accessing the trials and clicking on the download gives you the possibility to download the applications that you have submitted and the notification part. So I think the only format allowed is PDF, not Excel, but it should be possible to do it.
Mm-hmm. Thanks again, Laura. I think we have a couple of questions that are for the next session, so I would like to move on first to some other questions, a bit less popular. So this one says, in case withdrawal of a notification already available for public view is needed, what is the timeline to have the notification taken down from public view when ST service desk ticket is raised?
Yeah, in the meantime, Anna, you want to take this?
Well, what I can say, I mean that we have a process to prioritize those the incidents that are reported by the end users. So obviously it depends if this notification needs to be withdrawn because there is confidential information that was added by mistake, or there is personal data, or if it is because there is an error, you made a mistake or whatever, and then you want to. So it depends on the case. It will be evaluated and it will take priority. I don't think because we are not, let's say, directly involved in the service desk can specify how much time it will take. What we can let you know is that there are certain priorities, and when there is a data breach or of confidentiality, it obviously takes priority over other things in terms of resolution. I don't know, Laura, you want to complement or add something more?
No, I think what is the timeline? No, as you said, it's a matter of prioritization. I got a bit distracted in the meantime because I was checking the download. Vicky, maybe I can share the screen and I can show how it looks like. I was curious from the previous question. So thank you for making me presenter. So because we have a little bit of time, just a few minutes left. So this is the trial that we were working on. You let me go here in order. You see this is the summary page, trial information notification, and then here you have the download functionality. And as a user, you can download applications. In this case, only initial we have. And then here you have notification. So let me make sure that maybe we download only the notification part, okay? And I click here on start download. Then I have a zip file that is generated, and you see this is the download for notification. And then you can see what has been downloaded from the system for the existing notification. So if I open recruitment, for example, this is what you get. The trial title, details of the trial UCT number, the business key that is generated every time that you do a submission. So in this case is ending 76, and here there was another one, 24, probably because of an update. And then here you can see the date of submission and the member states concerned. So just to give you a flavor, because I was playing a bit with the system when the question was raised. So I hope this clarifies also visually what is possible to download. I think, Vicky, we have time for a couple of 2-3 more questions, right? Because we would need 5 minutes for the final wrap up.
Yes, we do have time, so we'll start sharing again the questions. And we were here, we just answered this question last, and we can go here. Is the end of trial at the member state or at the trial level?
The regulation is clear that you have to submit end of trial to each member state concerned, and by definition, the last member state concerned when the end of trial is submitted is equal to the end of the trial in the EU. So we have in CTIS end of trial at the member states level and end of trial for the whole EU, and both of them are recorded in the system. Let's say you have seen as the overall status has changed when I sent the last notification of end of trial in the last member states concerned. So hopefully now it's clear.
Yes, thank you, Lara. It's very clear. So we are, oh, here it is.
And I think, Laura, for the previous one, if I remember well, they have to enter also the global end of the trial.
Global end, if is applicable, yes, if there are countries outside of the EU. I forgot to mention, I was thinking about it when I was presenting the summary of results, because this is also another question that we get quite often when the clock starts for counting the 12 months for the obligation to submit a summary of results. And now that Anna mentioned the global end, I think is a good time to clarify. The clock starts from the end of trial in the EA. So So the regulation is clear that when you finish the trial in the European Union or European Economic Area, then there are 12 months for the submission of the trial results. It's not the global end. So you will still have the possibility to provide the information of the global end if there are sites outside of the EU. But in terms of compliance with the obligation to submit the results, is the end of trial in the EA that counts. I wanted to mention this when I was presenting the summary of results and forgot, so it's good to clarify this now.
Well, Laura, thank you for this important stress and clarification. We can now move on to a few more questions. This is one of them. Should end of recruitment date be the same for all countries, global or EU last patient in, with the exception of any countries that have closed recruitment early for any region? It's similar to one we have addressed.
I think the end of recruitment, like the other notifications that you have seen, is per member states. You can submit it for each and every member state concerned as is applicable, or you can do one notification for all of them. So it doesn't have to be exactly the same for all the countries, with the exception of countries where maybe the recruitment has stopped earlier. It depends on the case. I don't know if there are more details on end of recruitment for notification in the Q&A from the European Commission, but in the system, if you have exactly the same date, you can just do multi-select, apply to more than one country and send one notification only. So I would say it's flexible in the end, how you want to populate the information in the system.
Thanks, Laura.
I would like to take the opportunity to clarify something in relation to the previous question for the summary of the results. So because when it's not possible to submit the summary of the result within 1 year, for example, when the clinical trial is still ongoing in third countries and data from that part of the trial are not available, which makes a statistical analysis not relevant, then the summary of results shall be submitted as soon as it is available. But in this case, the protocol shall specify when the results are going to be submitted together with the justification. So you have to bear that in mind as well.
Okay, thank you for adding this one, Anna. We have time for one or two questions. Which one would you choose? One of you of these four in front of us?
I think there is the question, is the global end of trial submitted? And we have already clarified that the answer is yes, that they have to include this date, but this is not the date that defines the deadline for the submission of the reports. Is the end of the trial in the last member state in the EA, the European Economic Area.
Thank you. As I said, there are some questions that are out of scope. For example, serious breach notifications will be addressed in our next session. So please, if you want to submit your questions in advance, you can do it even now. In the event page, there is a Slido link for such questions. Per country authorities inspection report. I think this also would be answered in the next session. Perhaps this can also go there because it refers to USMs and inspected event serious breaches. And just to finish with these questions, we can take also this one. Should we notify the start of recruitment for each country involved?
Yes, the answer is yes.
Okay, thank you. We are approaching the hour, so these are the questions like we have time to answer. I think we did pretty well answering your questions. And I would like to thank our speakers, Laura and Anna, and to ask our dear attendees to please keep your Slido session open because there is a post-event survey where you can express your satisfaction for this bite-sized talk. And before we go, I have a few more things to share with you, and I will use the PowerPoint to do so. So we are here, yeah. And as I said, your feedback is very much appreciated and valuable to us, and it helps us prepare for future events. So make sure to find 1 minute to answer 2 very simple questions in Slido. Also, the questions that you have submitted today in Slido will be used as input to EMA training and support materials as usual. And the presentation we have used today will be uploaded in the event page within a few days, while the recording will also become available within 60 days following the event as per our multimedia policy. Thus, we always recommend our attendees to sign up to the Clinical Trials newsletter for information on when the videos are published and also on upcoming events. I would like now to give you a very short overview of the next CTIS events. So for the month of October, we have a walk-in clinic on the 5th of October, and we have on the 19th another OMS troubleshooting session for CTIS users. You can submit your questions in advance for these events, and November is also quite busy, as there is a CTIS webinar that you would need on the 16th, and this webinar requires registration in advance. Then we have another walk-in clinic on the 20th of November, and on the 23rd we have announced the next bite-sized talk, where we will wrap up on the notifications focusing on the circumstantial events notification, like serious breaches, unexpected events, errors and safety measures, etc. Please take note on the great opportunity we offer our audiences to submit your questions in advance for all of these events. And we would like to remind you that we prioritize answering these questions received in advance from you, and you can use the Slido links found on the respective event pages. We would like also to remind you that all upcoming events are hosted by EMA or CTIS, can be found on EMA's CTIS training and support page. We hope you enjoyed this CTIS bite-sized talk, and please, if you have, please show it in the feedback survey. And we do look forward to hearing your feedback there, as I said. And thank you again, Anna and Laura. Many thanks to our audience for your participation. I wish you all a lovely evening and hope to see you in the next CTIS bite-sized talk.